Are you suffering from a sharp pain in your heel all of a sudden? Are you complaining of a foot pain early mornings? Is there any pain in your heels as soon as you step your foot on the floor? If yes, then this is the video for you. Welcome to Medicine Ki Pathshala. I'm Dr. Manali. So today we'll be talking about heel pain. For that, let's talk about the normal anatomy of a foot. All right. So this is the normal structure of a foot. This is the dorsum part, the plantar, the medial part, and the lateral part. All right. Now, depending on the site of the foot pain, the causes of the foot pain is identified, right? You can have pain in the foot anywhere, right? You can have it on the foot, you can have under the foot, you can have in the medial part of the foot, or you can have in the lateral part of the foot. You can even have on the toes. Fine. So out of these types of foot pain, I have chosen heel pain solely because roughly nearly up to 80 to 90% of patients I get of heel pain of plantar fasciitis. So that's the reason I actually wanted to do a video on heel pain today. All right, so let's get started. So see, in heel pain, you actually get the pain in the heel, of course. Along with this, you might get pain in the medial part of the heel here. You might get it on the center of the foot here, or you might get the pain just below the toes here. Fine. If at all you're getting pain in any of these parts or all four areas, then you're likely to suffer from heel pain. In medical term, that is called plantar fasciitis. Fine. So now let's go in detail. What is heel pain? What are the causes? And what is its treatment? So this is how the heel pain occurs. For this, we need to know the anatomy first, right? So let's talk about it. This is a normal heel bone, calcaneus. These are the toe bones, metatarsal bones. This is a ligament. The ligament is a connective tissue. This helps to join one bone to the another bone, right? And what does the ligament do? It also restricts hyper movement between your bones, which means they prevent hyper movements like bending, like twisting, like tearing, right? So ligaments are very important to keep your bones, to keep your structure stable. This is a tendon. What does a tendon do? Tendon is responsible to attach the bone to the muscle. Plus, tendon serves to move the bone or the structure. Fine. So tendon is responsible for the movement and ligament is responsible for the stability. Fine. So anything happens to these two or any of these leads to heel pain. Fine. So let's talk about the plantar fascia first. Fine. So if at all there is any injury or any rupture to the plantar fascia here, it leads to the pain in the heel joint over here. Can you see? Just down on the heel. If at all there is any rupture or injury to the tendon, you will suffer from heel pain here, just above. Okay, so if at all there is pain down the heel or above the heel or on the heel, it comes under the category called heel pain. Fine. So these were the two main reasons that how does heel pain occur. Now let's talk about the main causes. कि कब ये सब होता है? What are the reasons when your ligaments or when your tendon gets ruptured? Even that is important, right? So let's talk about it. So here are the causes of heel pain. There are roughly 6 causes. Let's take the first one. The first one is overuse. When do we overuse? We overuse when you're obese, fine. When you are overweight, you give loads and loads of pressure to your ankle joint, resulting into heel pain. All right. Number 2 is walking with heavy weight. For example, going on a trekking, fine. For example, climbing the stairs with heavy weight, or simply coming out of your grocery store with loads and loads of bags filled with groceries, right? Even that's a heavy weight, correct? So if at all you are carrying heavy weight and walking, then obviously you will suffer from heel pain because you're giving pressure to your ankle joint, that is straining your ligaments and tendon, leading into heel pain. The third cause of overuse is overstretching. For example, you're overstretching your muscles, you're overstretching your ligaments of your lower limbs. That might strain your ligaments, that might strain your tendon, leading to heel pain. Fine. So hope you understood the first cause, that is overuse. It could be because of obesity. carrying heavy weights while walking, or overstretching. Now let's talk about trauma. What is trauma? Trauma is any injury. Fine. For example, you landed up to a fracture. This is trauma. So if you are having any fracture, then you are obviously damaging your ligaments, your tendons, right? Your soft tissues that might lead to heel pain. Understood? Now, the other example is, for example, you have stepped onto a very sharp object like this. Then again, you're damaging your fascias, right? Leading to heel pain. Understood? So these two were types of trauma. This was a direct trauma, fracture. This was an indirect trauma in which you are you're damaging your ligaments. Now, the third cause is biomechanics. This is very important. See, everybody has got a normal and a simple biomechanic, let's say normal curvatures of spine, normal curvatures of your neck, normal curvatures of your foot. Fine. By some reasons or due to some reasons, if you are disturbing the biomechanics, then it might lead to heel pain, of course, along with other conditions. But since we are focusing only on heel today, I'm talking about only the heel, right? So number one is flat foot. Now, what is flat foot? This is a normal arch of your foot, right? For example, for any reasons, for example, you're pregnant or you're overweight, or it comes in your hereditary, right? So in your genetic also it comes that you might get a flat foot. So if at all you have a flat foot, then the body mechanics is disturbed. Obviously, in normal foot, what happens is your body weight is divided equally onto your foot. It equally gets distributed to your heel and your toes, fine. And as a result, the weight doesn't come solely on your fascia, solely on this ligament, fine. But in flat foot, can you see there's no arch here? यहाँ पे बिल्कुल भी arch नहीं है. So क्या होगा? आपका जो पूरा body weight है वो पूरा यहाँ पे आएगा आपके fascia पे, जिससे जो आपका fascia it will get ruptured, fine, resulting into heel pain. Now, just for FYI, I am saying, how do you get to know that whether you have a flat foot or your normal foot? Simply just immerse or just dip your foot into water, fine, and then just step on the dry floor, so you'll get the impressions, right? If at all you're getting a normal arch, it is normal. If you're getting, if there's no arch or no curves, which means it's a flat foot. Understood? Now, moving on to the other biomechanics problem, that is wearing improper shoes or wearing high heels. Obviously, if you're wearing high heels, then whole of the body weight is coming to your tendon, this tendon, tendo-Achilles, which we say, or it is coming onto your toes, okay, resulting into heel pain. All right. And the last one is your gait. Everyone has got a typical walking pattern. Everyone, even I have got, right? Now, who will let you know this? Your parents, your family, or your friends. Ask them, they'll tell you. So normally what happens is, normally your foot should be in straight line like this. But for some reasons, some people try and give more pressure outwardly. Some people try and give more pressure on inwardly, resulting into abnormal gait. Correct? So how do we get to know? Number one, as I said, you can ask your friends, fine. Number two, look at your sleepers, guys. Look at your footwear. They will tell you how. If at all you're giving more of the pressure on any of the sides, then obviously you will see the impressions of your legs or of your foot onto the sleepers. They'll get deformed. Okay, उनका shape बिगड़ जाएगा sleepers का. You must have seen, right? किसी का toes की तरफ ज़्यादा दबाव होता है sleepers पे, किसी का heel की तरफ, किसी का अंदर, तो किसी का बाहर की तरफ पाँव में, right? So if at all this is happening, which means your gait or your standing or your walking pattern is something wrong, right? So this is this is how you get to know. And just again for FYI, अगर आपकी sleepers ऐसे deformed है, then it is high time to throw them off and get a new one. Fine. So this was all about the biomechanics. Next is arthritis. Obviously, if at all you're suffering from rheumatoid arthritis or gout arthritis. What is arthritis? That is inflammation of the joints, pain in the joints, right? There's some problem with the joints. So agar ankle joint mein kuch to issue hai, then obviously you will get some associated pain in the heel also, fine. So this is one of the commonest reason of heel pain, arthritis. Next is nerve issue. Very common yet very complex nerve issue. What is it? Let's talk about it. For example, this can you see the picture here? These are the nerves, fine. हर एक spine में से हर एक nerve निकलती है, और ये जो भी nerves हैं वो पूरे it travels right from your thighs to your hips, and then they get inserted towards your heel, right? Origin इनका back होता है और insertion इनका heel होता है, fine. और जो भी nerves हैं, जो भी sacral nerves है, lumbar, जो भी lower back की जो भी nerves हैं, वो सब. So imagine any nerve here is getting impinged, let's say in sciatica. It's fine. This is very common. Sciatica nerve में impingement होता है. So you might get an associated pain in the heel bone. Fine. That doesn't mean there's problem in your heel, guys. It means there's problem in your back. But you will get pain on the anywhere where the nerves are traveling. You can even get on the hips. You can even get on the calf. But since we're talking of heel, I'm focusing only on heel. Fine. So here we are required. Your Google will not tell you everything. Please don't be self doctor or please don't do self diagnosis thinking कि हाँ ये सब मैडम ने पढ़ाया हो गया मुझे समझ में आ गया heel pain क्या I am an expert. No. What if you are having a back pain here? Fine, you don't know. So your doctor will diagnose it. They will assess you. They will do certain physical activity, certain physical examination. Your physio will do certain physical examination. And he will let you know that you have a problem in back and heel pain is your associated cause. So even if you're trying all the treatments of your heel pain and it is not going, you will start cursing me, thinking okay, I told you all the treatment but still it is not working. But no boss, the problem is on the back. So you should be treating your back and not your knee and not your hip. Understood? So this is a nerve issue. As I said, it is very complex because the pain is somewhere else, but the cause is somewhere else, but the pain is coming somewhere else. That's the only reason. And the last cause is tumor. This is very rare, but still if you have any cyst or any tumor, कोई गांठ जिसको बोलते हैं, वो कुछ भी आपके पैर में होता है, then you might lead to heel pain. So these were the causes of heel pain. I am pretty much sure that now you are clear. Fine. Now let's talk about typical features of heel pain. What are the typical features? Let's talk about it. So if you have heel pain, number one feature is as soon as you get up early morning from your bed and as soon as you step your foot onto the floor, it would be an unbearable pain on your heel. Yes, why? Simple reason. When you were sleeping for 8 to 10 hours, आपका जो plantar fascia था, यहाँ के जो muscles, ligaments थे, those were in total rest, right? But now as you have placed your foot on the floor, it has suddenly got stretched, right? And पहले से ये weak है, पहले से ये ruptured हो चुके हैं, पहले से injured हैं ये, and again you're giving your entire body weight on the foot, then obviously they will scream out of pain. Fine. And that's the reason you experience pain in the early mornings. It is worse in the early mornings. As the day proceeds further, it becomes okay. Fine, because the ligaments gets used to it. Fine. But if you don't get any treatment, then it gets worse also as the day proceeds. So once I let you know the treatment, you will get to know that why am I saying this. Number two is pain in the bottom of the heel here. This is the main feature. मैंने आपको जो पहले बताए हैं कि पेन आपको सेंटर में भी हो सकता है, जस्ट टोज के नीचे भी हो सकता है, वो तो हो ही सकता है. लाइक इट कुड बी, इट कुड नॉट बी, बट दिस इज समथिंग कि पेन हील में होगा ही होगा. Next is the pain starts suddenly. You will feel that okay, I'm fit and fine, and suddenly you will get a pain. Fine. So this is again a typical feature of heel pain. Next is sharp pain in the center of foot. You might get the pain. सारे pain का nature अलग होता है. It would be dull pain, it would be sharp pain, it would be pinching pain, something like that. So the main feature of the heel pain is sharp pain. And the last one is if you don't get any treatment, then the pain will increase over a period of months and it will become worse. All right. So these were the typical features of heel pain. Now I'm going to end here. You know why? Because the treatment is going to take long, right? I really want you to understand every bit of it, and treatment will really take next 10 to 15 minutes. So for making it more simple, or for making it more understandable, I have divided this video into two parts. This was part one, in which I explained what is heel pain, what are the causes, and what are the typical features. Wait for my next videos. Stay tuned. I will be soon coming up with the treatment of heel pain. So for this, you need to subscribe. You need to hit on the bell icon. Only then you'll be notified when I come up next. All right. Till then, work out on it. Stay tuned. I will be coming up next soon with the treatment of heel pain. Thank you so much for watching, guys.